Over 25 million people in the U.S. have type 2 diabetes, and 7 million people are undiagnosed. They're not aware that they even have it. And we find that in our local area, there are definitely diabetes disparities. Type 2 diabetes tends to occur more among racial ethnic minorities, people who are overweight, who have a history of diabetes in their families, and also the elderly. So you have something like 26% of type 2 diabetes patients are elderly. But we're finding that a lot of younger people are getting type 2 diabetes as well. And we know that in order to address disparities, we have to work not only with the populations that face the disparities, but the populations that can help to address these disparities, particularly healthcare professionals.
Other program that we have in order to remove cultural barriers is cultural competence training that we do. We have a few ways in which we accomplish this. Number one, we have face-to-face trainings, which what we do is we go through physician ground rounds, for example, and teach about how to provide culturally competent care to XYZ community. So far, we have trained over 5,000, between 5,000 and 6,000 employees and providers through those trainings. Another great program that we're doing is what's called, we call it the Beat It program, which is we partner with the Office of Minority Health Resource Center from DHHS at federal level, and we're creating 2 training programs. One of them is for providers and physicians, nurses, etc., that care for patients with infectious diseases such as HIV and hepatitis B, as well as diabetes. And then that's for the providers. But also the training is going to be developed for the community, the patient population themselves, in order to help them better adhere to treatment, understand the resources that the community has, and other areas that we really want to go through from medication, but also through diet and other components, particularly when it comes to diabetes.